Diane now has a few questions. Diane Bath. So let's see if we can answer these, Diane, in a sort of a stepwise fashion. There's a few questions here, so let me make sure that I get to all of them for you. Says, if the anterior approach has less restrictions, why would it not be the only way to do hip replacement? Good question. So in the past, every hip replacement approach at one point or another has been the new best thing, okay? And there's always been reasons why people argue for that approach over others. I think the thing to keep in mind is that hip restrictions or restrictions after hip replacement are very surgeon dependent. So there are many, many, many surgeons who do the anterior approach, who do ask their patients to have a certain period where they follow a certain set of restrictions after surgery, and there's many surgeons that do not. As well as with the posterior approach or the lateral approach or the anterolateral approach or some of the newer approaches like the direct superior or minimally invasive superior. Many of those surgeons simply don't have their patients follow any restrictions. Again, it's really a pact that you're entering in with your surgeon. You need to be comfortable with them. You need to be comfortable with their skills and their knowledge. And if you trust them, you are trusting that they're going to do the best thing for you after your surgery, regardless of the approach that they use. But great question.